So I thought that I would end the discussion with just a few slides about future research and educational opportunities in palliative care. I do think palliative medicine, at least in the United States, has a fiscal imperative. If you don't buy into the moral, ethical, and frankly, the goals of being a physician to care for your patients and relieve their suffering, in the United States, crazy healthcare system and the way it's financed, there certainly is a fiscal imperative to decrease utilization at the hospital level, to decrease rehospitalization, to shorten inpatient stays, and to get patients out of the hospital. If you do symptom assessments of patients using, for instance, the SPEED tool and can identify their needs early and treat their needs early, early emergency department-based palliative care can decrease hospitalization and increase quality of life across a number of different markers. And without going into the research around all of those, suffice to say that, that this becomes an important fiscal imperative to getting your emergency providers to do the right thing for your terminally ill patients when they're in the emergency department, because the downstream effects save lots of money, both at the individual patient level and at the hospital level. We're working to get core domains of palliative care added to what's known as the model of clinical practice in emergency medicine. This is a compendium of topics that are included in the board certification exam for emergency physicians. We believe all 14 of those domains that I identified are primary palliative care domains, and that all physicians who practice emergency medicine should be skilled in dealing with all 14 of those topics. The identification of quality of life indicators can be difficult. At the end of life, what makes for a high quality life when you're dying, right? I mean, this is a difficult question to answer. And identifying what good quality of life is when you're on your last month of life, your last week, your last day, this is a challenge, and we need to better address those. And then obviously we want to focus on interventions and consultations for our patients.